Remember when we thought our hands could fix anything? Well, I could be wrong, but my thinking of manual therapy has changed radically over the years. It's just that some physios use manual therapy on all their patients, and others don't use manual therapy at all. The truth is in the middle, as sure as Sydney is full of sharks and sunshine. I started with Maitland, then I studied the Nordic Kaltenborg Evgens School. I did the Mackenzie courses, which were surprisingly loaded full of manual therapy. But the Mulligan concept was my favorite approach. A lot of the Mulligan manual therapy can be taught to patients as home exercises, like the lateral glide with pain-free activity for tennis elbow. Interestingly, these Mulligan home exercises techniques look a lot like Kelly Starrett's band techniques. Did anybody else notice that? Interesting, isn't it? This is taking the manual therapy ideas and giving them back to patients for self-treatment. We'll come back to this idea, I promise. I got the idea for this video wondering how does manual therapy fit into modern healthcare, because the success I've seen comes from education and exercise, with just a dash of manual therapy. And yes, I have to reluctantly agree that a wee tiny sprinkle of passive modalities does help from some patients sometimes. These observations come from patients not doing their exercises. I know, what a shock. No, exercises means no improvement. Even when my physio buddy was mobilizing and gliding patients like crazy, if the patients didn't do their exercises, they didn't see the improvement. That's not the secret ingredient, that's just the truth. Keep watching for that secret ingredient, it's coming at the end. Chapter 1, Manual Therapy, a tool, not a cure-all. So when some patients come in saying that their last physio could palpate a 2-degree malrotation of their L5 transverse process, I know I'm up the creek. The thing is, research shows that manual therapy's effects are primarily neurophysiological, not mechanical. Go to the Google Scholar and search for mechanism of manual therapy. Loads of references there. I'm not alone in my thinking. My views align with those of many other professionals. For social proof, I like the YouTube videos of Adam Meekins, like this one here, and the YouTube videos of Greg Lehman, like this one here. So instead of immediately recommending manual therapy, start educating patients about the role of physical activity and lifestyle factors in their problem, coaching patients about the benefit of active versus passive treatments. That was my previous video here. Sitting with patients, acknowledge that what they've said, but also deflect them toward where you want to go. Say something like, I understand your previous physio used manual therapy and I'm glad it helped you, but you've returned with the same problem. Research and clinical experience have shown that the combination of hands-on techniques and active exercises often lead to better long-term outcomes. Let's go through some exercises that you can use to manage this today and in the future. Do you understand? Chapter 2, Empowering Patients, Active Participation in Their Recovery. Sure, get a 0 to 10 pain scale. Everyone does. Measure range of motion and manual muscle testing. Look at the gait, palpate, and inspect. But most importantly, determine the patient's functional loss. If you're stuck for functional questions, look at some of the scales and questionnaires that are available. Look at the Oswestry Low Back Pain Disability Questionnaire, for example. You don't have to use all the questions. Maybe your patient has a desk job or a driving job. Ask them how long they can sit comfortably. Even if you don't use the entire measurement tool, you can re-ask that same question at reevaluation to gauge progress. Consider manual therapy as one component of a comprehensive treatment plan that emphasizes education and exercise and activity modification. Using my 3-diagnosis and 3-treatment simplified approach to physiotherapy, it is the patient struggling with recovery of motion where manual passive range of motion techniques are most useful. And be careful with your words. Be positive, be supportive, cultivate that therapeutic alliance with your patient. This is so important. Use open-ended questions. Ask them if they have any questions for you. Ask them and ask their accompanying family if there's anything else that you need to consider here. So if you're a snap, crackle, pop, whiz-bang manual therapist kind of physio, you probably didn't make it this far into my video here. So if you're still watching, then you're in for a special treat, the icing on the cake. Bonus chapter, Engaging Patients is the secret ingredient to physio, intrinsic motivation, active participation, and functional restoration. Number 1, Fostering intrinsic motivation. Work with your patient to set goals that align with their functional loss and expected recovery. Explaining why patients need their given exercises helps them put them in a context. Also, be sure to single out that one most important exercise and tell them why. If they only do that one exercise, why this one is the most important. If you're curious to learn more, look at this video here. Number 2, encouraging active participation. Empathize, acknowledge, validate their situation without catastrophizing, even if it is a catastrophe. Ask them and try to problem solve any obstacles. Provide positive feedback and encouragement. Tailor treatments to each individual's interests and preference. I have more details in a video here. Number 3, address their functional loss. Present their home program as their ability to self-manage their recovery in this episode and in the future. I know it's more lucrative to have patients keep running back to your clinic, like a subscription model for healthcare, but I'm too busy. I want to help each patient and then move on to the next guy. For more information, check out this video here. I've seen patients come in with all kinds of ideas from Dr. Google or some medical drama show on TV. But the truth is, there's no substitute for a trained physiotherapist. We're not just here to use our magic hands. We're here to educate, empower, and guide our patients towards a better life. That means teaching them how to help themselves. So the next time your patient demands you crack their back, I hope you pause and think about it. Does this make you think about manual therapy differently? I encourage you to consider how you can implement these strategies in your own physio practice. Let me know what you think. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Get ready for more sparkle, this video right here, and let that subscribe button be your gateway to a world of endless possibilities. Thank you.